Welcome to the Dunwoody Dialogues. We're so glad you are with us today, and hopefully this is your first time tuning in. If not, you've been here with us before, welcome back. We're so glad you're here. I am Mark Galvin. I am your host for the Dunwoody Dialogues. We are streaming live on YouTube, Facebook, and LinkedIn, and we would love for you to chip in. Give us your thoughts about the show. We would love to have more folks interacting with us on our social channels. This show is brought to you by Discover Dunwoody, and Discover Dunwoody is the official destination marketing organization for the City of Dunwoody. That means we want you to come to our cities, stay in our hotels, eat at our restaurants, shop in our shops. That is our main goal here at Discover Dunwoody. But it's not the goal of our show today. The goal of our show today is to introduce you to an expert in the field of OCD, and we'll get into more of that in just a moment. But let me start off and tell you this. He has over 40 years of experience in mental health treatment. He is a licensed clinical psychologist and an assistant professor emeritus at Emory University School of Medicine. He specializes in treating anxiety and trauma-related symptoms, and today he's here to talk about something that affects millions of Americans, but is often misunderstood, and that is obsessive compulsive disorder, or as a lot of us know, it's called OCD. Our guest today is Dr. David Reedy, and it's spelled Ready, and I'm so glad he's here today. Dr. Reedy, welcome.
Thank you.
So glad you are here with us today. You and I met each other through Rotary. Mm-hmm. So in a little plug for Rotary, it's such a great organization, but we're not here to talk about Rotary. We want to talk about OCD. But before we get there, tell me this. Why is it that you have focused on OCD?
I find OCD really fascinating. It's amazing the different ways it shows up, sort of the different types of obsessions people can have, and the compulsions they develop as a result thereof. I like treating OCD because people generally get better fairly quickly. Most of the patients I work with have a significant change in their life within 12 weeks of treatment.
So that's fascinating.
And if they do their homework. But my job is to help them learn what to do and how to do it. But it's really neat to see people change. I became a psychologist because I like to see people change. It's one of the things that drew me to this field, and it's just amazing work.
You've said something I think is really interesting, and that is that you help get people better. So you, in a way, you run off all your clients.
Well, my job is to work myself out of a job with everyone I work with.
That is great.
My job is to have the person finish therapy because they don't need my help anymore, because their symptoms are reduced. They have more control of their symptoms. Now with OCD, there's no cure for OCD, but I teach people how to manage it. Like there's no cure for diabetes, but you manage it. There's no cure for OCD that I'm aware of, but you manage it. And if you manage it right, it has much less of an impact on your life.
That is great. So let's get into OCD. How many Americans are affected by this condition? And why do you think so many people are underdiagnosed for it?
Well, the research suggests that 2.3% of Americans have significant symptoms of OCD at some time in their life. That's 1 in 40 people. And the reason why it's so often.
So wait a minute. I'm as a ratio, and I'm a simpleman.
Yeah.
So, if 1 in 40 have struggle with OCD, and I look at our Rotary, right?
Yes.
We have about 40 people that get together every Friday. There's a chance that one person in that room is dealing with OCD.
Good chance that
Wow.
they are. But a lot of people don't talk about their OCD symptoms because they're ashamed of them.
Okay.
For example, it's not unusual. People, one form of OCD is a fear that you may be gay, and when you're not gay, or a fear you may be a pedophile when you're not a pedophile. And some people may be afraid to talk about that, or may be afraid to share that with other people because they're ashamed of those thoughts.
Sure, I can understand that. So the question that I have now is, how is OCD diagnosed, and what should somebody look for if they think they or a loved one may have it? And there's a piece here that is important, and that is certainty. How does certainty impact those items?
So the way we diagnose OCD is there's a thing called the Diagnostic and Statistical Manual of Mental Disorders, which is sort of what the field of what the scientific field of tells us about what is a disorder.
Okay.
And so and that's all put in a book, and we're on the 5th edition now, put out by the American Psychiatric Association. And they say in this book, it says that OCD is characterized by the presence of obsessions and compulsions. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted. Obsessions cause anxiety, stress, and other emotions such as disgust. And these are very powerful thoughts. They're very intrusive. These emotions are intense and unpleasant, so people with OCD attempt to ignore, suppress, or neutralize the obsessions to feel better. These mental acts or behaviors are called compulsions. Compulsions are repetitive behaviors or mental acts an individual feels driven to perform in response to an obsession or according to a rigid set of rules.
Now, you told me before we started our talk today that an OCD, something that someone has OCD, they would be afraid to grab a door handle.
That's one type of OCD, but there are different types of OCD. Now, in the media, OCD is displayed as being a fear of contamination or being overly organized, but there's a lot of other different types of OCD that have nothing to do with that.
So I would think that's what makes it harder to diagnose, right? And I think that's the point that you wanted to make, is that there is people can have OCD, but they're thinking, okay, the door handle thing is, I'm afraid of getting germs. Well, that's not what I'm obsessing over.
Right.
It's other things. How do they determine, okay, I think I'm obsessing over something too much, and they know that they should pick up the phone and call someone like you?
Well, it's a coordinated impact on your life. See, generally speaking, if it's not impacting your functioning, then we don't consider it a disorder.
Okay.
So it could be a quirk. For example, some people collect bottle caps, and
Sure.
so that's a hobby, right? But if you have to have every single bottle cap, if you think about day and night how to find the next bottle cap, that could be an obsession.
Okay. So my wife making a puzzle. So every Christmas she puts a puzzle out and she's got to finish it. She's motivated to finish it. But that's not obsessive, because when she's finished, she's done with it.
But that's not a negative impact on our life.
Very true. Yeah.
And so if it doesn't have a negative impact on your life, it's not considered a disorder.
Okay.
And that's really key, because OCD can have a profound impact on people's life. One of the things that is kind of annoying to me is that people say stuff like, I'm so OCD as a joke, when OCD can be a very serious disorder. It can really control your life. For example, I was working with someone recently who, because of obsessive thoughts, did not drive for 6 years, which greatly...
What were they afraid of? Was it
afraid
literally the worry of getting in a car?
Worry of getting in a car and worry of causing an accident. And we work with that, and now she drives, inside of 2 months of treatment, now she drives almost every day.
Oh my gosh, that's so terrific.
With much less anxiety.
Interesting.
And so another person I worked with had a tremendous fear that she would hit somebody with her car. And like if she went over a bump or she went over a branch in the road, sometimes she would circle back to make sure she didn't run over somebody. And so those obsessive thoughts can really control your life, can limit your life. One of the most famous cases is Howard Hughes, who was at the time one of the richest men in America.
Right.
And yet he had one of the most miserable lives. If you look up the last couple of years of his life, he was absolutely miserable because he wouldn't leave his house. He did a variety of different behaviors because of his fear of contamination.
So Howard Hughes is one of those classic examples of someone who had OCD, and maybe even the media blew it up and turned it into something too specific. Where and I heard that he would never leave his house, and he died in the 50s or 60s.
Right.
So this is a little bit of time ago. What I'm curious about is, you're a psychologist, not a psychiatrist, which means that you're not going to prescribe a drug.
Right.
And maybe there's people out there saying, well, I don't want to take a drug to get over something. I could see that being something, and other reasons. But what you're sharing is you have a systematic approach to help someone understand and really manage their OCD so that they can move forward. Is that right?
Right, because everything I do is focused on what we call evidence-based treatments.
Okay.
Research about psychotherapy has been going on for like 100 years now. And evidence-based treatments are the treatments that they have the most scientific evidence about that support them, the most randomized controlled trial. Now, for OCD, that treatment is called exposure response prevention. Exposure response prevention has been proven again and again through numerous studies, and even comparing it to other treatments, to be one of the most effective treatments ever developed for OCD. It often creates a lot of change in people's lives, and it really, if you want me to go into, I like to talk about one of the studies that was done in England.
Please do. This is a great study.
And it sort of demonstrates part of how exposure and response prevention works. For decades, psychiatrists and psychologists are pulling their hair out about how to deal with OCD, because the things the methods that do well with normal anxiety, normal depression, do not do well with OCD. In fact, they kind of backfire over time, and people are stuck in therapy forever with little change. But one of the early experiments done on this is they took a bunch of patients who were concerned about contamination so much, and they washed their hands and showered so much that their skin was breaking down in their hand, and they were severe. They put them on a psychiatric unit. They locked the door and they turned off the water. And so people could not do the compulsive behavior. They could not excessively clean themselves without access to water. And initially, the patients said, "This is horrible. This is terrible. I can't stand this." And they said, "Stick with it." And day after day, the obsessive thoughts they had that they had to wash became less and less intense. In a matter of a couple of weeks, they didn't really matter that much anymore.
Wow.
Because they had habituated to the thoughts.
And this was a large group of people. Now they were fed. This wasn't a cruel treatment or anything like that. So they got them food and things like that.
Oh yeah, no,
they just
very
had no water.
Very well treated, but they prevented them from doing the compulsive behavior.
Wow, so interesting.
That had so dominated their life and was very destructive.
Can we take that and apply it to something that you've done today, where it's not that type of example of a different type of OCD?
Yes. For example, I mentioned earlier, I worked with a woman who was afraid of driving, and she would do things like she had a camera that would film whenever she drove.
Okay.
Because she was afraid that she would run over people, and then she would review the camera.
Oh, my goodness.
And after she got home from driving somewhere, she would walk around her car to see if there were any dents or any blood on her bumper or anything of that nature. Sometimes she would even listen for police reports or watch the news to see if there's any evidence that someone had been injured on the route that she was on.
That is certainly impacting her life.
And then when she stopped doing those things, when she stopped reviewing the camera, she stopped looking at her car afterwards. When she stopped those sort of behaviors, then her obsessive thoughts became less and less. She also did a thing where when she would go in a supermarket, she would have a recorder to record what happened in the supermarket, because she was afraid that she was going to attack somebody.
Wow.
And so
what you're sharing is that people with OCD don't just have obsessive compulsive disorder about one thing. It typically will translate to other areas too.
And they can also have more than one theme at the same time, you know. And so, but they can have more than one thought. And again, obsessive thoughts have the following categories, the following characteristics. And really if you understand this, and it's very important. One, they're intrusive, they're involuntary, they're intrusive, they're physiologically arousing. You have a fight or flight response to them. Or you can have other emotions like disgust, but a very negative emotion. They have urgency. That you have the feeling, I've got to do something about this, I've got to do something about this now. And then they suggest, the obsessive thought says, you got to do this, you got to do this, you got to do this. And it's on repeat. And it's intense, it's on repeat. You got to do this, you got to do this, you got to wash your hands, you got to wash your hands, you got to wash your hands, you got to wash your hands. So it's over and over again, these thoughts. And then when the person does the compulsive behavior, they momentarily feel better. They do it for a reason. For example, they wash their hands, or she would review the tape to make sure that she hadn't run over somebody, or things of that nature. But then once they do that, they've actually increased the likelihood of the thought happening again.
Right.
They do what I call feed the beast. They get on this merry-go-round of doing having the obsessive thought, doing compulsive behavior, feeling better for a little while, then having the obsessive thought again, doing the compulsive behavior, feeling better for a little while, and it's just this merry-go-round that goes around and around.
So
and
the feel better part is the relief,
right?
And so they automatically, and you actually compared this to alcoholism,
Yes.
in the same sort of fashion. That you don't want to give a beer to someone who is an alcoholic. It's the same thing. You've got to somehow break that cycle.
Right, and for example, people with OCD often ask for reassurance from their relatives. For example, an adolescent may ask their mother reassurance about something, or they look at Google. I have a rule with my patients: thou shalt not Google. So one of the main way people seek one of the strongest compulsion that people have is seek reassurance in some way. And so if you, for example, have a son that's seeking reassurance about thoughts that he may be gay and he's not, and he asks you for reassurance about that, if you give him the reassurance, it's like you're giving a beer to an alcoholic. They'll feel better momentarily, but you fed the addiction, you fed the compulsion, you fed the obsessive thought.
Now, this doesn't mean that if someone goes to their parent and says, I got a question about this, that it'll, that they're saying you're not, that doesn't mean they're OCD. Let's take that parent.
Right.
What would that parent want to look for to say, okay, I have something that's gone deeper?
The key is that when you give the person reassurance, they get relief, but that their relief evaporates. And they come back with the same or a similar question over and over and over again, because no matter how many times you tell them that they're not gay, or they're not a pedophile, or they're not this or not that, that they're not likely to harm somebody, that's not going to fix it, because all you've done is reinforce the importance of the thought. Also, you asked about certainty earlier. The core to understanding OCD is a person with OCD is seeking certainty about something they cannot be certain about. That you can never be absolutely certain whether you're gay or not. You can never be absolutely certain if will ever be a pedophile. You cannot be.
Yeah, but can't you be certain?
You can feel absolutely not. In that, can you be certain that you'll never be gay? That you'd never harm a child. I had one guy who was afraid he was going to rob convenience stores.
See, I would say I'm pretty certain I'm not going to rob a convenience store.
But you don't have an obsessive thought. Then you don't have OCD. The thing about it, are obsessive thoughts about that. People with OCD have a glitch in their brain.
Okay.
And that glitch in their brain causes this behavior. That the thought causes anxiety. The thought itself feels dangerous.
All right.
You feel like you're in danger. You want to get out of danger, so you do a compulsion. OCD runs in families. If you have identical twins, then the person, if one has it, the other person is much more likely to have it, but it's not a total one-to-one.
Oh, that's interesting.
But I've rarely run into someone with OCD that didn't have a sibling or a cousin or a parent or sometimes a grandparent that doesn't have OCD.
So it can be definitely hereditary.
Oh, I think there's a huge hereditary component to this.
You had shared an example of a young person who thought they were online, and they thought, well, not even online in this case, I thought they were in the Matrix, and they were responding to that, and which I think the Matrix is a very interesting story, and part of the beauty, if you will, of that story is you really don't know if you're in the Matrix because you're officially plugged into the Matrix, right? So I can see how that happens. What do you do with someone who is, even a young person, who may be going through these sort of OCD responses? How do you manage that with someone who thinks they're in the Matrix?
For example, you start out with learning what are the compulsive behaviors, because you can help them stop doing the compulsive behaviors. Then the intensity of the thoughts become less and less and less.
Okay.
You habituate to the thoughts, because when you have the thought and you don't do the compulsive behavior, eventually your body learns that the thought's not dangerous. The key to OCD is to understand that the thought makes your body react as if it's dangerous. We believe what we feel.
Okay.
If we feel like we're in danger, we believe we're in danger. The thought
Because
says,
our body's responding, that must be something I need to be afraid of.
exactly.
Wow, okay.
But by not responding, eventually your body learns that the thought's just a thought. But it feels very, very real.
That is scary in a way.
Well, it is, but
Yeah.
it's also something that's treatable, because if you can help the person do it. Now, you start out with it, we'd say, why can't a person just do it on their own? Because people often make the mistake that they try to do too much too quickly. They
Okay.
become overwhelmed and they give up. That's a very common pattern.
I could see that.
And so they say, well, I'm just not going to do anything. And then
So it's much better to have a guide.
well, you have to have a guide. So we start out with a hierarchy about what are the thoughts, and some thoughts are more intense than the others. We work on the middle of the thoughts. We start out with kind of the ones that cause the middle level of anxiety, and once we do that, the person starts to gain more and more control. Also,
Okay.
their tolerance of anxiety becomes much greater.
Which has got to be important, right?
Oh, it's essential.
Yeah.
And once
The older I get, the more tolerant I get to things that stress me as a young person don't stress me today.
right. Well, and because and when they do, you're not as afraid.
Sure.
It's just
Exposure,
anxiety.
right?
It's
A lot of it is
exposure.
that.
It's just anxiety.
So, if someone is out there and they have a loved one or maybe themselves, they feel like they may have an OCD tendency, what should they do?
Well, they should seek out getting assessed for that by someone who's an expert in OCD. By someone,
Great.
Because a lot of people are not experts in OCD. A lot of mental health professionals, they think they know what OCD is, and they try to treat OCD as normal anxiety. It's not normal anxiety.
Okay.
Because when you treat it as normal anxiety, they may feel a little better, because you actually become a source of reassurance.
All right.
But they won't get better, or they won't stay better.
Now, let's say I'm somebody who I think I may have OCD, and I'm afraid it may hurt my career. I'm afraid it may hurt my job. Can I feel comfortable going to a professional and that not becoming public knowledge?
Well, of course, because what you say to, for example, if I'm treating someone, what they tell me is confidential. I cannot share that information without their written permission.
See, I think that's I think a lot of people know that. I wanted to hear you say it because I think it's so important for folks out there thinking, I don't want anybody to know I'm dealing with this because I want to keep this hidden. But go get help. And you can see a professional like you who is going to keep it confidential and will be able to get you through it. And you know what? Maybe nobody ever finds out that they're dealing with this, and you can help them get back in the car again.
Exactly, or do a variety of other things.
I think that's important. It's a basic, but I thought it was important to mention.
Well, also OCD grows. The symptoms can get, if not treated, the symptoms can get worse and worse and take up more and more of a person's life.
Yeah, that's just horrible. All right, great. We got people out there that are watching decide, okay, they need help and they're in Atlanta. How can they find you?
They can either call me,
Okay.
and there'll be in the show notes, there'll be information about that.
Perfect.
Or they
What's
can
your
look,
phone number?
It's 770-354-4272.
Perfect.
Or they can look me up on Psychology Today. And remember, my last name is spelled Reddy, but pronounced Reedy.
It's Reedy.
Yes.
I am never going to say the other name again. You are always Dr. Reedy to me.
Dr. Reedy.
And I appreciate you coming in and sharing this with us today. You and I have talked a number of times about this, and I wanted you to come in and share the, if you will, the details about OCD because, well, quite frankly, I think, 1 in 40 is a lot of people, and I think we can help folks, and I think that's super important.
Oh, most people, if they get the right treatment, most people get better, and OCD has much less impact in their life.
I love that. Well, thank you for the work you do and helping all those folks out there with OCD.
Okay.
And thanks to you for watching another episode of the Dunwoody Dialogues. Such an interesting conversation here today, and I hope that you have found this interesting, and I hope you will go back and look at some of the other shows that we've had because we're always looking to bring on great guests that can help you do something different in your life, or in this case, help yourself or potentially someone you love. This show is produced by Discover Dunwoody, the official destination marketing organization for Dunwoody. Our director is Madison Holtz. We love the work that she does there behind the board and puts all of this together. We always want Everybody in Dunwoody and beyond, you don't have to be in Dunwoody to want a sticker, but this is our Dunwoody sticker. They're absolutely free. They're great for laptops, for the backs of cars. We bought a particular type of paper that this is removable, so you can feel comfortable putting it anywhere you want. They're free. Just go to City Hall, come here to Discover Dunwoody. Even NFA Burger has them. But whatever the case is, if you want a Dunwoody sticker, you let us know. We'll make sure you get one. Thanks for watching. We're here to serve, and we serve through our website. So go to discoverdunwoody.com to find out about restaurants and hotels and parks and all the kinds of entertainment that we have here in Dunwoody. We even carry the events that are happening in Dunwoody. So if there's a Taste of Dunwoody coming up, an event that you can go and try different restaurants, that's going to be right on our website. Also, check out our social media. At Discover Dunwoody is our handle. You can find that everywhere. Dr. Reedy, thanks again for joining us. I love the things that you've shared about OCD. Helps me understand how I can recognize that in my loved ones. And we love that you're a part of our community.
Thank you.
And for all of you, thank you for watching. Now, come Discover Dunwoody.